Transposition of the great arteries. Transposition of the great arteries, which I'll refer to as TGA, is a congenital condition in which the pulmonary artery and the aorta are transposed in the heart. Normally, the pulmonary artery carries oxygen-depleted blood from the right ventricle to the lungs, while the aorta carries oxygenated blood from the left ventricle to the body. However, in TGA, oxygen-poor blood returning from the body flows from the right ventricle to the aorta, carrying it back to the body, bypassing the lungs. The oxygenated blood is recirculated through the lungs instead of traveling to the rest of the body. So basically, the left and right sides are not communicating and are functioning independently. As infants, we have the foramen ovale and the ductus arteriosus, which are holes within the heart. They allow for some mixing of the blood. However, it's not enough oxygen to sustain the body. Therefore, infants with this condition have cyanosis. TGA is a life-threatening condition. Survival without surgery is impossible. Surgery is usually required within the first few days of birth. Prior to the surgery, medication may be provided, which is the prostaglandin E. Infants with TGA have increased heart rates, increased respiratory rates because the heart is overworking. They also feed slower and tire easily. Therefore, as nurses, we would watch the heart rate, oxygen levels, and the heart rhythms. Diagnostics and labs to determine this diagnosis is made before birth by ultrasound or echocardiogram. After surgery, it may be the physical exam, chest x-rays, electrocardiograms, echocardiographs, MRIs, and the hematocrit and hemoglobin would be checked. As mentioned earlier, surgery is usually required within a few days of birth. There are 2 procedures that could be performed, at least 2. The heart is usually reconstructed to attach the aorta to the left ventricle, and the pulmonary artery is attached to the right ventricle. This is called the arterial switch procedure. Also, there is the balloon atrial septostomy, which is done during cardiac catheter.